And good morning, everybody. Welcome to the webinar. Today is our summer preview of the 2022 Open Enrollment. And before we talk about that, my friend Eric is walking in the room, and he's going to sit next to me, and we're going to go over this. But just a little bit of housekeeping. If you have a question, put it in the chat box to the right. And what's more, if there's any issues with your sound or the technology, just let us know. If you're hearing me loud and clear right now, please give me a big thumbs up or something in the question box. And I want to make sure everybody's got the sound going on. So please just throw something in the question box right now so you can hear. Oh, fantastic. So thank you, Denise, Aziz, everybody, Melanie. Thank you so much. And Eric, if you wouldn't mind, just swing around here and say hello to everybody in TV land.
Good morning, everyone. Thank you for joining.
All right. Fantastic. So Cornerstone, we're so proud. We're celebrating 7 consecutive years as being one of Cincinnati's top workplaces. So I want to give us a pat on the back for that. 7 consecutive years. And it's guys like Eric and the rest of the team. I mean, they make this stuff happen. So here's a good picture. Eric, if you got any questions about the individual market, reach out to us. There's my email, his email, 20 years of experience between the two of us, and we've seen it all. So I want to help you guys out in the individual market. Pilot your business, and we will be your flight crew. So introducing the updated agency services program. As a Cornerstone broker, you have access to a myriad of services that will help you and your business outside of your scope in planning for the future. The ASP is designed to help you plan for your business, your clients, and your family, no matter the situation. And among the services provided in ASP are the Autopilot Client Referral Program, the Parachute Succession Planning, the Flight Plan Retirement Assistance, and the Co-Pilot Service Agreement. It's all right there. It's all based on an aviation theme. Okay, and as an ASP broker, you are the pilot of your business, and we are your flight crew. Okay, check it out on our website right there. And this is self-explanatory. We're in the middle of our incentive program campaign. It's between January 1st and December 31st of this year. And the top qualifier gets 7,000 points, $7,000. And second place, 5,000. And the top 15 qualifiers will earn cash. Qualifications start at 2,000 points. We've also already got a boatload of agents at that threshold. So check it out. It's for individual, ancillary, and medical, and the group medical and ancillary. New sales only. Without further ado, let's talk about Open Enrollment 2022. Okay, spoiler alert. As of today, the 28th of July, I don't have like a full-fledged, carrier by carrier update of what they are showing because of the reforms. A lot of the carriers have pushed their rollouts a little bit later. The intention of today was just a teaser, and this will be a 2-part presentation. We'll do another one in early September, but please stay put. Okay, don't hang up yet. We're going to go over some stuff, and we're going to go over a lot of the detail about the current market, and more importantly, about the current reforms that are in place. I think more importantly, there's so much going on with subsidy reform, with unemployment, with potentially new subsidy enhancements and whatever. So I want to dive into that a little bit and just talk about the current state of the individual market. So don't touch that dial. We're going to go over this. It'll be a fast-paced presentation today, and it'll be done in about 20 or 30 minutes, and take your questions afterwards, and we'll have a really good, engaging presentation. And I want to point out a lot of this material comes from you guys. So a very good collaborative effort upon everybody out there in the Cornerstone community. So much of our material comes from you guys. Some of it, updates every day. So I really, really appreciate all the work you guys do, all the tips and stuff you send over to us. We want to keep everybody aware of what's going on. That's what we're all about here. So FFM certification is no longer, available for 2021. Okay, they're shutting this down this weekend. So, I mean, if you haven't been certified for 2021, it might be too late. Okay, they're going to shut it down, I think, on Monday. So you're wondering about FFM certification for 2022. That generally rolls out now. Well, spoiler alert, they haven't announced a date for that, only that it'll start after August 15th. Okay, and if you got any comments or something like that about what you're hearing out there, or need to correct me or anything like that, shoot it in the question box and we'll address those. And so what I want to point out, after the 15th, we're going to be sending you stuff, links and whatnot, but essentially you'll go to portal.cms.gov. And I know we have some new brokers out there today, and that's the process. You're going to go to portal.cms.gov and choose new user. And once the training is complete, you'll see it out there on the data.healthcare.gov site. It's the tracker that the carriers use. Okay, so for you new brokers out there, I'm recruiting new brokers all the time. That's the process. So another thing to remember, all brokers, you need to reset your password every 90 days. And then here's another tip from the FFM, from the federal government, okay, talking about using the ACA product, and we've seen a big enhancement in that. Use help on demand. This has been huge. This is the government's generated referral program, and agents have commented how well this works. New clients from everywhere. These are free referrals. You don't have to sign up for a lead system or anything like that. Essentially, when a client reaches out to the government that they need an agent on healthcare.gov, they ping you. They send you an email because you're in their vicinity. Okay, so they send you an email, and you got about 15 or 20 minutes to reach out to the client. Okay, and that's how that works. Talk to me if you have any more questions about that. And then Eric's going to talk about Health Sherpa, our #1 ACA enrollment platform, and it's free. Let's talk about Health Sherpa. Eric.
Yes.
I didn't get that. Could you try again?
Uh-oh. Can you hear me on there, Geoff? Good.
I can hear you.
All righty. So now we have Health Sherpa. It's the largest ACA and agent enrollment platform. And we've been using this for over 2 years now. And it's just, I think it makes everything so much easier with enhanced direct enrollment. If you guys have any questions about this, just we have a form that you can fill out. That way that will get the process started on getting your account created. But the benefits, there's no redirect to healthcare.gov, which saves you a ton of time. You can get enrollments done in 10 to 15 minutes instead of sitting there and waiting. Like it says there, there's no more waiting rooms. Everything's pretty much automated. Your shop and enroll, everything is all on one site. You're not bouncing back and forth through tabs and stuff like that. You just continue. It has a great comparison tool. Has a drug and provider search. It will also list different documents that are needed for your clients, and they have technology support yearly. On the top of your account, you'll have a service number. If you call them whenever, they're 24/7. They're always there to help you. Anytime something goes wrong in that system, we can always call them and get everything going. And they do a great job of their reporting and analytics for your clients on that home screen. There's NPN overrides, and there's a ton of other stuff, little things there. It's crazy that Health Sherpa is such a great platform and it's free. So if you need help getting set up, use this link down here, and this will come straight to me. And then I'll begin to work on that process of getting your account started. Sometimes we run into the problem of an email's being used. It's not really a problem. If you have another email, we could use something like that, or if not, we can get that reset. We just send a reset password to you, and then you just log in and create that. And then we make sure all the carriers are on there for you. That way you can see all the comparisons.
Fantastic.
let me just touch on a couple things here. The great thing I love about Health Sherpa, it spreadsheets everything. So as agents, half the battle is won when you create a spreadsheet for the client, and this enables them to choose. So it's a beautiful platform. I think it's the best. More than half of the ACA products sold out there are through Health Sherpa, believe it or not. It's first and foremost the biggest broker enrollment platform out there. So let's dive into ARPA. So what is ARPA? So ARPA is the American Rescue Plan Act, okay, also known as Biden Care, okay, that's what I call it. And let me get some stuff out of the way here. And okay. So a little background, the Affordable Care Act has been around for 8 years. Goodness gracious, it's been around, it kicked off like 2014. And so last year was the 8th open enrollment for Obamacare, the ACA. And I'm sure everybody's aware that what took place was it sort of started to wither away a little bit. There were actually more and more people uninsured. Part of that had to do with pricing. Part of that had to do with the availability of subsidies. So the new administration, the Biden administration, unveiled a couple of steps to address this. Okay, they wanted to increase the amount of insured folks, the individuals, independent insured folks. So they were improving the affordability, and they want to reduce the uninsured. Okay. So some details here, and I'll link through this. So February 15th through May 15th was a new open enrollment SEP. This has been expanded now to August 15th. And this slide hasn't been updated, but this should read August 15th. And it functions like a new OEP. No documentation is needed. You can apply the last day of the month or the first of the following month. And like the OEP, you cannot be on Medicare or Medicaid. If you're not eligible for a subsidy, you have, or if you have affordable group coverage, and you may switch plans, even carriers. And again, this slide has not been updated, but the period is from May 1st through August 15th. August 15th. So enrollees can apply for July, for August 1st effective date, even the September 1st effective date. Sorry that these slides have not been updated, but that's how the rule works. We're still in the middle of this, and just some background on the affordability. The American Rescue Plan will lower premiums for most people who currently have marketplace plans, and it'll expand access to financial assistance for more consumers. And it'll start on April 1st. Premiums on these new savings will decrease on average by $50 per person, or $85 per policy per month. And 4 out of 5 enrollees now can find a plan for $10 or less. That's right, you heard me right. So 80% of the individual market out there can find a plan for $10 or less. That's a huge, huge expansion of the individual market. And to date, they've already enrolled 1 million new people. Okay, so that's unprecedented for the off season for the SEP. So 1 million new people. Generally, it's much lower than that. It's maybe 1/10 of that during the summer months, and that's nationwide. So, we're seeing huge growth in Ohio alone. I know a lot of Ohio brokers are out there. We expect to enroll, 50,000 to 100,000 new people, okay, through the expansion of these SEPs. And just some background on this, how this works. You might be scratching your head. Well, what does this work? What is this all about? So in the old system, I say current, but the slide hasn't been updated. Under the old system, the upper end of the poverty level subsidy threshold was 50,000. Okay, and the ARP is going to enhance that. So in the old system, somebody above $400,000 didn't get a subsidy, but now they do. Okay, just as long as it's under 8.5% of their income. So there's going to be a huge increase in the number of folks that get a new subsidy. Okay, no one will pay more than 8.5% of their income for the benchmark silver plan. So there's no more subsidy cliff. That's what it's called. The people that were above the 400%. That guy making $60,000, he wasn't going to get a subsidy, but now he is. Now he is. He's going to get a subsidy. Okay, because the only thing that matters is that he no longer pays more than 8.5% of his income for a benchmark silver. And this is an illustration of what the cliff is. So again, this guy, making just above the threshold, $51,000. And I hope, I'm doing a good job with this. And by all means, include any questions that you have so I can elaborate. But the fact of the matter is, somebody that was above the $51,000 threshold, he saw his premiums get jacked up really high. It was, if you're like making $60,000 and you're going to have to pay full freight for your health insurance plan, what I call, a non-subsidized plan. They were really expensive. Okay, somebody who's made maybe that income level and maybe 55, 56 like me, they're going to pay $700 or $800 a month for a plan. And a lot of these folks, right here in this zone, we're not getting insurance. And so they changed the parameters so you no longer pay more than 8.5% of your income. As a result, a lot more folks can afford these plans. And a lot of these folks started getting subsidies. And I hope I explained that well. Let me fix the camera a little better so you can see me. All right. So I hope I explained that well. By all means, if you have any questions or want to elaborate on that, just shoot them in the email, in the question box. So just some more illustration of how you can benefit from the enhanced subsidies. So this is just a spreadsheet we put together. So under the current system, a guy age 50 might get $179. Somebody making 40 here might get $179 in subsidy. And with the new ARP subsidy, also called Biden Care, it jumps up to $296, almost double. Okay, the subsidy. So so the current benchmark, the old benchmark silver plan was $328. Now the new benchmark silver plan is $211. Okay, and I did an illustration here of a family of 4 in Ohio. Okay, and these were people above the 400% FPL. They're making $105,000. Previously, they didn't get any subsidy. Previously, this family of 4 was going to have to pay $2,092, and now during the enhanced subsidies, it's only $751, and what we're talking about is a reduction of 64%. So they saw their premium go from $2,092 to $751, and we've seen a lot of this. We've done a lot of this. We've done hundreds, if not thousands, of these in the past months, and we've still got another 2 weeks to do this. So for the open enrollment. So this open enrollment lasts for another 2 weeks, and what's more, you can go in anytime and update their premium throughout this year and next year, and they can enjoy those new savings immediately. So this goes on forever, for the next 2 years, I should say, not forever, for the next 2 years. And here's a nationwide indication of which states were affected most. Okay, and the illustration I used was Ohio. Okay, And as bad as it was in Ohio, there were states in a much worse position. So in West Virginia, these savings are even greater. So if you're prospecting in West Virginia, have them look at the new subsidies. They're going to see a dramatic, um, improvement on the affordability. And I have a sense that a lot of folks in West Virginia, because of the high cost, maybe just bailed on the ACA or going uninsured. So this would be a good prospect base for new clients. Same for Kentucky. So a lot of people, bailed on the ACA in the past couple of years, but now it might be worth a second look. Okay, and by all means, follow up with me if you have any questions on this. Okay, and as I alluded to earlier, these will extend through 2022, and as of today, they're going to stop after 2022. Okay. And how are we doing on time? So about another 10 or 15 minutes, and then we'll get to your questions. So how's it going to work? Okay. So you can take it now or you can take it later, the new subsidy. Okay, the new premium subsidy. And this, was impacting, as a late rollout, so it didn't impact your medical premiums until after May 1st. Okay, for people that went on Health Sherpa and adjusted it. And the other option is option B. You can just skip all this, don't do anything, pay your bill, whatever, on your ACA plan, and then claim the new enhanced subsidies at tax time next year. But wait, you said subsidies will be adjusted retroactive to January 1st. Yes, I said that. I did say that. Okay. Retroactive to January 1st. How's that going to work? I know the you didn't see it impact your premiums until May 1st, but what about that 5-month, say 4-month period prior to that? Well, you'll call that back at tax time. Okay. And again, January through April subsidies, also known as APTCS, will be amended at tax time next year. And for those who don't take the subsidy now, you can just adjust the full year's subsidy at tax time next year. And a question I get all the time, will off-exchange clients be able to get these new subsidies? And that is a no. So off-exchange is a different animal altogether. It has nothing to do with the FFM and the subsidies. There is a viable off-exchange market that's also known as the private exchange market. And, but ultimately it doesn't involve the subsidy. And there's still a lot of clients that are doing the off-exchange. And there's still carriers that offer the off-exchange channel. I would say it's a very small sliver of the entire, ACA market, maybe 5 or 10%, but there's still a substantial number who do this. Let's get to the ACA carrier commissions and market footprints. Okay. So Ambetter in 2021 is primarily the I-75 corridor, and then over in Northeast Ohio. They've also expanded into Columbus a little bit. And just to rattle off some of the high points with Ambetter, these are our carriers again. I'm going to roll into these a little bit and talk about strategy and talk about marketing. So this is 2021, and I don't anticipate this changing much for 2022. But in Cincinnati, they're primarily TriHealth, Mercy, and UC. Up in Toledo, they have the Mercy, St. Luke, and Toledo Children's System. In Dayton, they use the Kettering affiliates, Kettering hospitals, and whatnot. And then at Ohio, in Columbus, they use Ohio State. Okay. And they do have the My Health Pays Rewards program. Hope I'm not going too fast for you guys. Okay. And Anthem. So Anthem uses in Cincinnati the Christ system, and UC in Dayton it's Kettering and Premier. So they have two systems up there. In Columbus, these are the Mount Carmel system, and in Cleveland it's the Metro and St. Vincent system. Huge footprint. I wouldn't state that they are the biggest player in the market, however. You know, I want to point out that this reads $16 per person per month, but only up to 2 members. And this is, for me, the kind of the headline, which makes it really tough on us. That Anthem does not pay commission outside of open enrollment. You heard me correct. They're not paying commission on policies sold now. Okay, we're in SEP. We're not inside the OEP. Okay, and so they're not paying commission. They do have a bonus program, however, and once 10 lives have been sold, then they start paying a bonus. But I wouldn't say Anthem is our strongest carrier here. Let's talk a little bit about Kentucky and Anthem. This is their market footprint, and you know it's a little complicated with all the different stripes and stuff like that. But the broadest networks are the ones that have the multicolor. Okay, multicolor, and I don't anticipate this changing much for 2022. And in addition to that, for 2022, we should see Ambetter moving in and Molina. So those two will be moving into this market. And that full announcement will be taking place next month. So we'll have more details on that. But we are appointing agents for Ambetter now in Kentucky. And Ambetter has Northern Kentucky and the Louisville area. So give me a call if you have any questions about Ambetter, okay, in Kentucky. I wanted to point that out. So Oscar, they're primarily in Central Ohio, Northeast Ohio. So they are not in Cincinnati and Dayton, and they operate like this. In Cleveland, they have one hospital system, the Cleveland Clinic, and so that's their major value add. Let me fix my camera. We're going to say goodbye to Eric. He's got a call that he's got to go on. And so in the Columbus area, they have Ohio State, okay? And they've expanded a little bit over into Stark and Tuscarora, okay, for the clinic. The clinic is up here, and down here is Mount Carmel and Nationwide. Sorry about that. Mount Carmel and Nationwide in the Central Ohio area. And by all means, if you have any questions about this, let me know. We're going to keep moving here another 10 minutes or so. And this slide should say Molina. I don't know why it doesn't say. It says Oscar. This should read Molina. Okay. This is Molina. This is a typo. So this is a Molina footprint, and I know it says Oscar, but it's the Molina footprint. And with Molina, they pay $18 per member per month, and they cover in Cincinnati, Mercy and UC, in Cleveland, Lake and Metro, and in Columbus, Ohio State. In Dayton, it's Kettering. One advantage they have, they still use the bronze and silver. And then dental plans, Anthem, Emeritus, DCP, Dental Care, Delta Dental of Kentucky, and Humana. Dental is just a shelf-rated plan. It's some variability based on your location, and some plans are more expansive than others. Talk to me more about dental if you have any questions about that. And then I just wanted to touch on the alternatives. With short term, which has been a huge player until just this year, The big players were National General and Golden Rule. Plus, we have IHC, and now Anthem has moved into the short-term market with Anthem Enhanced Choice. And new on the horizon is a disruptor, and that's what I want to call these guys, disruptors. Everybody's heard of, how DoorDash or Uber or Airbnb have disrupted certain industries. The new disruptor is called Sidecar, okay? And what this is all about is this revolutionary and really fascinating area of health insurance. I don't want to call it health insurance, it's more like health indemnity, indemnification. It's the true cost direct pay model. In other words, you're going to use a program where you access the direct pay model of every hospital and provider. And you're wondering, what are you talking about? And this is what I'm alluding to. In 2020, in the Trump administration, they passed a law that states every hospital needs to show their direct cost for every procedure, not the contractual costs that they have with the carrier, which might be super inflated, and not some, obscure kind of, made up cost that some people see on their surprise bill. And I've had dozens of these things where the cost just doesn't add up to what the true cost is. The government has mandated every hospital create a direct to consumer off the street price list, and every hospital has to comply with this. And it's out there. I've seen it out on cms.gov, and I'll share it with you in the follow-up emails I send with you. But every hospital is supposed to show what they would charge an off the street customer for X, an MRI, a gallbladder operation, something like that. Anything. Every CPT code has a direct cost, and that's where Sidecar comes in. Sidecar has a fully insured product right now marketed throughout the country, and you've seen the ads, and that's what they're talking about. Is it's a fully insured product based on the direct pay model, and we can share more about that with you. And I want you guys to learn more about this as we go along. And another thing about direct cost is there's a provocative book written by this incredible writer named Marshall Allen, and it's called Never Pay the First Bill. Okay, he is a nationally known writer. He works for ProPublica, so he's been interviewed in numerous outlets, and his battle cry is never pay the first bill. And this really addresses things like surprise billing. Okay. And as brokers, you guys have all seen these insane bills, where somebody goes to the ER and then there's like an air ambulance bill for $35,000. I mean, where did that come from? So this book, this topic, all this is kind of addressed in this new model, this disruptive model called Sidecar. And I want you guys to learn more about that. And another disruptor, and it's been around for actually quite a while, is Health Share. And this is based on Health Sharing Ministries, and Altrua is our product for that. And this is based on the Health Share Ministries, which are not insurance programs, more like community share programs, faith-based community share programs, where products have been built out to use a health share arrangement to pay for costs. And I can tell you more about that as well. That's administered through Crown Administrators. Okay, we're wrapping things up, and then we'll get to your questions. Autopilot is, the referral program, and I alluded to that earlier. And you can quote and enroll support and provide year-round services to your clients through Autopilot. And why am I talking about that now? It's because after all this stuff, a lot of guys are saying, "Oh my gosh, I am so buried. I'm focusing on Medicare. I'm focusing on group. Geoff, this seems like a ton of stuff." It is. So if you need to, we can help out. We can, share in the compensation as well. That's autopilot, and that is the on the individual side, we call that the ARC Benefit Solutions referral team. And here's their markets, basically the I-75 corridor and Texas and a little bit of Pennsylvania, basically red states. So, wrap your head around that. And then, as I alluded to earlier, folks are busy. You guys are busy, and you guys are focusing on a lot of stuff. I mean, my hat's off to you. You guys are the rock stars. We work for you. That's what this is all about. You guys are the rock stars. We want to make your life easier. And by doing this stuff, to help you learn about the ACA market and do it yourselves, or if need be, you can take a powder and let us help you. So our referral team can get to work for you on that. And, the eligible clients, could be employee benefits, individual, Medicare, whatnot. So talk with us more about this. And with that, okay, I went 7 minutes after. It's 7 minutes after 10. Let's get to your questions and keep moving on. And okay, I do appreciate all comments, even the snarky ones, but I might not comment on all the snarky comments, but you're welcome to include them. So I do appreciate snarky comments. Let me get to the questions again. I hit the wrong button here. Okay, so let's just keep rocking here. Okay, as a member pointed out earlier, the slide indicated that the ARPA OEP, I'm sorry, as one of the reps pointed out, the OEP read through December 15th of 2022. They are talking about extending it to January 15th of 2022. So OEP for 2022, in all likelihood, will go to January 15th of 2022. As of today, it's December 15th, and the government has announced a new rule, a new proposal to extend it to January 15th. So OEP will be extended, and in all likelihood. Okay. Okay, so I do encourage comments. Okay, and this is the something that came over today. A comment, somebody saw what's called a batched redetermination for everybody that has not gotten an updated subsidy for 9/1 or effective 9/1. Okay. So time out, take a breath, Geoff. What Shelley is alluding to here is something that came over today about these enhanced subsidies. And like I mentioned, you should be able to take the subsidy now, or if you're in the minority, you can just take your Biden Care subsidy later at tax time. Okay? The government announced today that they're looking at implementing this more on a proactive basis and imposing the subsidies on people, whether they've taken it or not. And I need to learn more about that. Personally, I would rather people have the option of waiting till later if they want to at their discretion, as opposed to just the government changing their subsidy midstream without notice. And we will certainly have more about that as we go along. Great question, Deb. Can you get a list of the hospitals for each ACA carrier throughout Ohio? I will certainly send that to you in the follow-up. And must you be licensed with all carriers when a client does an application through Health Sherpa in order to be paid? Okay. No, you don't have to be licensed with the carriers in order to get comp on Health Sherpa, because Health Sherpa has a referral program. So you can be an agent and you sell somebody like a Paramount plan, or a Suma plan, something that we don't market, and the Sherpa will pay you a referral. Okay. I did fail to mention something in the rollout too, as far as markets that we've added. We just recently added CareSource, and I know all you guys know about that, and I'll include that in the slides. Okay, including the hospitals that they cover. So we do have CareSource, but you'll get a copy of the hospitals. I'll be sure to send that. Will each of the ACA carriers, can we get a list of the hospitals? Absolutely. That's the next question. Must you be licensed with all the carriers? Okay. We're wrapping things up here. Some of the duplicate questions. Did you say there's a 2-year window for the higher subsidy? Yes, that's true. What happens afterwards? I don't know. Okay. Okay. Somebody gave me a hats off. Thank you. I appreciate it, and sorry about the mad dash, and we'll do this again in a couple of months. Maybe a little more polished, a little more detail on what the future holds for 2022. And with that, we'll conclude the presentation. Everybody, make it a great day.